Good morning and welcome to Veterans Heartbeat on the Pulse of the Veteran, where we discuss issues of health, happiness, opportunity, and well-being of interest to the veteran community, their families, and the community who honors them.
Good morning and welcome to another episode of Veterans Heartbeat, brought to you by River, the Rural Institute for Veterans Education and Research. My name is Jason Zentgraf. My co-host, Ed Lisowski, is here with me, and he's the Executive Director of River. We welcome you to weekly wide-ranging discussion of issues, events, opportunities, and needs in our veteran community. Good morning, Ed. How are you doing?
Good morning, Jason.
We'd also like to thank our sponsor, The Man Shop. It's a great place for a guy to get a haircut. If you need a haircut, swing on by and check them out. The gals there do a great job. We are also sponsored by River, the Rural Institute for Veterans Education and Research, who offer many services to veterans, such as a weekly free TBI and vestibular disorder testing, and educational programs that focus on veterans helping veterans. Today we have Jonna Brenton, the Vision 19 Lead Women Program Manager, here to talk about Women's Veterans Healthcare Program. How are you doing, Jonna?
I'm doing very well. Thank you for the opportunity to talk with you today.
Well, thank you very much for being on our show. You want to take it away, Ed?
Well, Jonna, it's been really an interesting fact that we have somebody watching over the women veterans. It's really nice. Can you tell me a little bit about your job, what your responsibilities and role is?
Sure. As the Women Veteran Program Manager, every facility, every major medical center in the VA is mandated to have a full-time Women Veteran Program Manager. It can be a nurse, a social worker. We have pharmacists in the role. We even have physicians in the role, but the role has to be occupied full-time. And basically, our job is to oversee the care that is provided to women veterans in that VA medical center or that VA healthcare system. So for Montana, for example, I have the medical center. I have all of our CBOCs as well as our community living center. And it's all aspects of care, particularly performance measures for gender-specific care like cervical cancer screening, breast cancer screening. We're very involved in environment of care rounds, so we actually are part of that team that goes around and we make sure that we're protecting the dignity of all veterans, not just women, but making sure there's things like locks on the exam doors, curtains, the correct placement of exam tables so that we don't place people in positions that would make them uncomfortable. We certainly work with leadership to make them aware of women's health issues and work with them as a partnership to ensure that women veterans are getting high-quality, comprehensive, gender-specific care no matter where they seek that care in VA Montana.
Well, that's great. So working through this, there are some specifics that women need for the medical care that men won't, like you were saying, breast exams, etc. What are some of the screening opportunities that you provide on a regular basis for the women veterans?
Okay. Well, let me start at a little bit higher level than that. I just want to highlight the commitment that VA Women's Program has made to ensuring that we have a workforce that is interested, engaged, and competent to provide women's health care. So at the very top level, Women's Health Services at Central Office has been funding what we call Women's Health mini-residency courses for primary care providers, nurses, as well as emergency department providers and nurses. They have been offering that for several years. They've trained well over, I think, 2,700 to 3,000 providers out in the field. And that's simply to make sure that no matter where a woman enters the VA system, she is going to be assigned to what we call a designated women's health care provider. And that's actually a designation that's highlighted in our computerized record system. So when we have a new female come to the VA, that female must be assigned to a designated women's health provider. In VA Montana, we have strong support for that training. We are currently sending we have 94% of our females assigned to designated women's health providers. That's way over the measure or the target that we're supposed to have. And our providers come back and they absolutely love the training they were provided. It's a combination of lectures, hands-on training, skills lab, and it's taught by experts that work in women's health in the VA system. So it is completely ran by VA for VA. We'll be sending 3 more primary care providers this year and a couple of nurses. And then Vision 19 is actually a sponsor for a nurse-only mini residency that we're having for Visions 19, 20, 21, and 22. That'll be held in August. And we're expecting to train over 70 nurses, both RNs and LPNs, in gender-specific care for women veterans. So when a female comes to the VA, they certainly do have expected screenings, not only for female-specific things like mammograms and pap smears, but also for diabetic care or cardiac care or, it's a full spectrum of healthcare services that we offer in our sites of care.
Sounds like you guys are really stepping up for the female veterans, and that's really exciting. One of the issues becomes the barrier of access to care that a lot of the veterans are perceiving. We had Mike Garcia talk a little bit about that. Can you explain if a female veteran, and there's a lot of females that are having some issues, how it differs for them to access this kind of care?
Well, I wouldn't say it differs so much. I did listen to Mike's interview. I don't think it's a barrier that we have across the state, but I do have to say that women's health, particularly, and I'm not sure if you're aware, but maternity care is something that is offered through veterans for eligible women veterans, and that's phenomenal that we're offering that care. But certainly we're not delivering babies at VA Montana. So despite, we are utilizing Choice and HealthNet for those services, but VA Montana is fortunate enough to have what we call a women's health nurse navigator. Her name is Catherine Shackelford, and she is the liaison between women's health care and that care in the community, not just maternity care, but mammography. That's another service that's offered through the VA. It's an eligibility for all veterans, male and female, if the need arises. But it's certainly not something that we offer under our roof, mostly because we don't have the volume to sustain that. And as a woman veteran who lives in Montana, if we had that service here, would we really require them to travel all the way to Helena to have their mammogram? That's not even reasonable. So this nurse navigator is the liaison. She's a registered nurse. She's the liaison between our women that come to us for VA and the community providers that help us ensure that they're getting quality care. As the maternity coordinator, which is part of her role, she calls those women veterans every 2 months on a regular basis. She provides patient education about alcohol use, tobacco use, intimate partner violence, depression. She makes sure that veteran has access to services that are included in our maternity benefits, like birthing classes or parenting classes or breastfeeding classes. And then she also makes sure that that woman veteran has the supplies that she will need when she returns home, like a breast pump and nursing bras and things like that. So we are so fortunate to have her to be that liaison between partnerships in our community.
So how does female veterans get a hold of her?
As soon as a female veteran comes to us, let's just assume that she is part of our healthcare system already, learns that she is pregnant, that automatically, when they put in the consult for maternity care, Catherine is automatically notified of that consult. And she reaches out to that veteran immediately, introduces herself, helps negotiate and get that first visit with the OBGYN started, reaches out to that OBGYN, tells them who she is, gives them contact information, tells them what her role is, and really opens that door to make sure that we work collaboratively to make sure that female gets the care that she needs.
That's great. What about the female veterans that have served in combat? Because we do have a number of them in this state. Is there any special programs for them?
You know, I'm not sure that we have programs that are specifically under combat, but if they do have any kind of trauma issues, you know, our behavioral health folks provide the same kind of care to our women as they would for men. And, you know, if we want to talk specifically about military sexual trauma, which, you know, gets a lot of, has been in the news a lot. We are, again, blessed with Kelly Downing. She's our military sexual trauma coordinator here. She certainly is well known in our healthcare system. When we screen all veterans for the presence of military sexual trauma. That's one of the things we do. And if they request and would like counseling or help with that, Kelly is notified immediately, and she reaches out to that veteran. And then Kelly, by virtue of that, would be the conduit by which that person could get connected with support groups or therapy groups within VA. And as you guys probably know, we have a very well-developed telehealth program, and so we don't always, it depends on the service, of course, but we don't always require that veterans travel all the way to Fort Harrison for care. Many times those same services are available in a telehealth model where they simply present to their closest clinic. We connect them with using the secured technology of video conferencing with their provider, whether that be somebody in behavioral health or any, or some kind of specialty care.
Now, for the female veteran out there, what is the requirement? Is it the same for eligibility as other veterans, or is there a special?
Sure. And I'd like to expand on that a little bit. I've been in this position for many, many years, 17 and a half and counting, I think. And some of the myths out there, particularly with women who have served in the military, is I don't think we always did a good job educating veterans about eligibility. And as Mike said in his interview, eligibility has changed over time, right? So, but women particularly have succumbed sometimes to the myth that, I'm not a veteran because I didn't serve 20 years, or I'm not a veteran because I only served stateside, or I'm not a veteran because I didn't serve in combat. I tell everyone, if you know somebody, if you know anybody who served in the military, do not ask women if they're a veteran. Ask them if they served in the military, and then ask them if they've ever explored their VA benefits. And if they haven't, I tell them to contact www.va.gov. That website talks about all areas of eligibility, talks about health care, talks about VA benefits, and it talks about our third arm of Veterans Administration, which is the National Cemetery Administration. But particularly, it gets them to a site where they can download or get information about how they apply for VHA care to see if they meet eligibility requirements. And as Mike said as well, they can always call our main number, 406-442-6410, and ask for the business office, which I think he said was option number 4, and talk to them about eligibility and get the packet mailed to them and have them fill out the information, because we don't know if somebody is eligible until they get that information to us.
Yeah, eligibility. What about those that have got other than honorable or dishonorable?
Again, that's, we say at this point, it's any, discharge other than dishonorable. So I'm not the expert in eligibility. That's why I direct everyone to our business office to explore all those issues. They are the topic experts for that.
I've worked on the crisis line with a few female veterans, and it does seem like the mental health services for the female veterans is probably some of the best in the nation that we've got here in Montana. Would you agree with that?
Well, I know that we have certainly dedicated staff who are proud of the work that they do for their veterans, and I, too, am proud. I have a multidisciplinary women's advisory committee, and behavioral health and military sexual trauma are both integral pieces of that team. We talk about the needs of women. We work together to make sure that we're always on forward momentum to meet those needs of women. Probably our greatest barrier is our beautiful, large state, but I think VA, Montana particularly, has done a phenomenal job about using technology where we can to connect veterans to their providers.
On average, we're seeing about 20% of the veterans coming back with some form of PTSD. Is that the way it is with the female veterans?
I would imagine that we're going to see a blending of those numbers, now that combat roles are open to women. I think you're not going to see any different.
What are some of the biggest obstacles you see in getting women to start participating into the VA system?
Well, one of the first is their willingness to seek out eligibility information. We have about 9,000 women veterans in Montana. We're serving about 2,758. Those are actively, we're caring for them, right? Enrolled veterans, women veterans, is a little over 3,000. So that means we've only reached 1/3 of the women veterans in this state. And actually, 30% isn't bad for market penetration, quite honestly, across the country. There will be a certain percentage that don't qualify for care based on eligibility, and, those are those complicated formulas and all that kind of stuff. But still, some of the data indicates that as much as 50% of women who have served in the military have a service-related condition. So that means we still have 20% that are probably out there that we're not reaching.
So those are the ones that you really got to go after.
Yeah. And, I'm attending town halls. I certainly have a well-publicized phone number, and, my name is out there. We just need to use venues like this to tell women, if you served in the military, make the call, get on that website, and see if you fill out the eligibility information, fill out the paperwork, and let's see if we can get you some benefits that you earned.
Yeah, that's the underscore here. It's not a welfare program within the VA system. It's an earned benefit.
Oh, yes, absolutely. I love the mission statement of the Women's Health Program that, oversees all of us. We want to address the health care needs of women veterans and work to ensure that timely, equitable, high-quality, comprehensive health care services are provided in a sensitive and safe environment at all VA facilities nationwide. And this is the line I love. We strive to be a national leader in the provision of health care for women, thereby raising the standard of care for all women. I think that says it all about the mission and the goal of Women's Health Services in the Department of Veterans Affairs.
And it sounds like, especially for the number of women that you are serving, you have got an array of services that are just phenomenal.
Yeah, I mean, the next one thing that we are just rolling out, and you guys have probably heard about that, is we've always offered some level of care for infertility. But right now, the VA is covering in vitro fertilization. That's brand new. And that's covered for veterans who are service-connected for infertility. And so we are just rolling that out. We're starting to take patients as of, the consult that we developed in VA was opened up as of, I think, just this past month. And so for veterans out there, male and female, who have a service-connected condition for infertility, reach out to your VA, and specifically reach out to me, Jonna Brenton at the VA, 447-7315, and let us try to figure out if you are eligible for that service, because in the situation where it's the male that is service-connected for infertility, we enroll their legal wife, their legal spouse, and we're able to provide that infertility treatment to the spouse. So this is really exciting for our veterans who have served, and due to their service, it has rendered them unable to procreate without the use of artificial or reproductive technology, I should say. And so I just, males and females, if you're service-connected for infertility and you want to seek out care for that, please contact me.
Well, John, it sounds like the National Women's Health Program is trying some new things, some very revolutionary things. Can you tell us a bit about the big picture about, where the VA is going?
Sure. We have maintained, and the data has maintained, that the numbers of women seeking care, the number of veterans, number one, women veterans, is going to increase and continue to increase. It's one of the only subpopulations that is increasing. At Big Picture VA, they know that, and their strategy is to continue to grow the infrastructure, to grow the expertise of the providers in the field, to make sure that women are going to continue to get high-quality, comprehensive care at the right place at the right time, and advance high-quality care to transform the VA so women veterans experience respect and recognition in their service, integrating women's health care delivery through strategic collaborations. That means, if we're not providing it under our roof, we need to be working with our community partners to make sure that we're sending them to qualified, competent providers in the community. Enhance the women veterans experience by providing tools and resources to women's health leaders in the field, and that can be your providers, your women's health medical directors, champions. We just want a really educated and engaged workforce in topics related to women's health care, and to address the unique needs of women through enhanced clinical programs and research. That's one thing that, even though VA Montana is not a research facility, VA is a leader in research, particularly for veterans. But there's a lot of research that goes on targeted specifically for women veterans as well.
One quick question before we let you go. From the crisis line that I run, we get some female vets with same-sex partners.
Sure.
And is that a problem for them to seek care within the VA?
It absolutely is not. And I will tell you that the other hat I wear is I am the LGBT Veteran Care Coordinator here at VA Montana, as well as overseeing those programs at the VISN. And we encourage all LGBT veterans to come to us for their care. This is a population that is marginalized, underserved, since the revision of Don't Ask, Don't Tell. We need to be the agency where they can trust in their caregivers, and we are welcoming our LGBT veterans to come to us for their care. And if you check out our internet page under clinical services, you'll see an A to Z list, and there's under L, because it's under LGBT, there's a whole dialogue. There's lots of resources there, both within VA and external to VA. My personal contact information is there, and lots of resources, policies that are there, fact sheets for veterans. This is an expanding area of healthcare, and we want those veterans to come to us, and we want to be a trusted source for them.
All right. Well, thank you very much. And it's been a quick show. I mean, this went fast.
Yeah. Some exciting things happening over there at the National Women's Health Program, and we're glad to have you involved and glad you're able to help out the women who serve our country. Thank you, Jonna.
And thank you for having me. I appreciate the opportunity.
Excellent. Well, thank you very much for listening to Veterans Heartbeat. We'd not be able to bring this to you without all the support of our listeners. And thank you again to the Man Shop for sponsoring the show. If you need a great haircut, swing on by and get a snip. Also, thank you to our main sponsor, River, the Royal Institute for Veterans Education and Research. They have an array of services such as a veterans-focused education and free TBI and vestibular disorder clinic and many more services. Check them out on Facebook or on the web at riverofchange.org. Lastly, we would like to show our appreciation to all of our veterans. Thank you for serving our country and keeping us safe.